Welcome to the Myrna Method live stream. In this video, it's going to be Karin Collins. She's the nutrition intern that worked with me 4 years ago, actually. So when you go through the program to become an RD, registered dietitian, it's a 6-year process. And Karin's in her very last months. She's going to be an RD and not hopefully, we already know she's going to pass that state exam in the next 4 months. So we are going to go over her paper for dissertation. This is what she researched. And it was really interesting that she picked something that she learned about when she was interning with me. And we were doing research on diabetes because at that time, diabetes, this was 4 to 5 years ago, it was all about sugar and insulin being the root cause. And what I found is actually that's not true. Sugar and insulin are a byproduct of diabetes, but the actual root cause of the disease is exactly what Karin's going to talk about today. It's excess fatty acids, particularly these fats called ceramides, that they're not yet measuring. I think they should be, and they will be in the future. But these ceramides, and what she's going to show in her studies and her research, are implicated in most metabolic diseases: dementia, type 1 diabetes, heart disease. These fats actually can cause valve damage in hearts, chronic heart failure. So these are really important fats to understand. They're the root cause of type 2 diabetes. And let's just give a little background. When you started with me 4 years ago, we started really talking about this. Talk a little bit about where your head was, because you were like, wait a minute. This isn't what I know about type 2 diabetes. And you were in school for 2 years.
Yeah, I was taking prerequisite courses before getting into my program, and I didn't know a whole lot about diabetes, aside from the fact that it seemed to be a condition of excess sugar intake, and that people who have diabetes have a problem with sugar and too much sugar in the blood. And so I was so surprised to learn this whole other side to the underlying cause of diabetes. And I was just so fascinated by this other mechanism that's implicating diabetes.
And all the other comorbidities that go with it.
Mm-hmm.
But here is the aha moment, is it's 100% reversible with diet intervention. Our biggest metabolic killers are reversible through diet. Now they're pumping us up with all kinds of drugs. And what she's going to show is her research. We're going to talk about diet. So why don't we let you take the show and roll with it? So let's see what this paper's. And by the way, I know she's not going to give her whole dissertation because that would be an hour's worth and most people's eyes would roll in back of their head. She's going to really just kind of hit the highlights.
Yeah, absolutely. And so this presentation will cover a brief overview of how ceramides contribute to the development of type 2 diabetes and the nutrition interventions to combat these effects of ceramides. So first, I'd like to start by covering some of the statistics on diabetes. So 366 million adults have diabetes around the world, which represents 8% of the population. And by 2030, this number is predicted to go up to 552 million. And in 2021, 38 million Americans were reported to have diabetes, which is 11% of the population, and 2 million of them have type 1 diabetes, making type 2 diabetes the most prevalent form. So because of how widespread it is and it's only predicted to increase, it's such an important condition. It's so important that we understand how diabetes works and how we can prevent, manage, and treat the condition with nutrition.
Awesome. That's a lot of people, by the way.
Yeah. And so a lot of people are struggling, and this condition starts in many cases years, if not decades in advance. And it's all begins with what we eat meal to meal every day. And so if we can learn about what contributes, what the dietary contributors are to type 2 diabetes and these elevated ceramides, then we can know how to make our dietary choices and how to adjust to be on track to avoiding diabetes. And so currently, so type 2 diabetes is a condition that is characterized by hyperglycemia, so elevated sugars in the blood, and insulin resistance, and cell death in the pancreas. The current biomarkers that are used to diagnose type 2 diabetes are the A1C, fasting plasma glucose, and oral glucose tests. So these tests right now are just looking at the sugars in the blood. And what we'll find today is that we need to look at a whole other side of what's contributing to the diagnosis of diabetes.
This is what they're measuring, but it doesn't mean it's the root cause of the disease. That was like with the CDC, Center for Disease Control, they talk all about sugar in the blood, which is a byproduct of too much fat in the blood. Bottom line.
Yeah, absolutely. So let's talk about normal insulin function. And so when you eat a banana, your pancreas releases insulin into the blood, and insulin then attaches onto the receptor site of our cells. And in our muscle cells, they'll send signals to the cell, to the transporter, it's called a GLUT4 transporter, to rise to the surface and allow glucose to come into the cell. So in order for us to maintain normal blood sugar, we need the sugar to get into our cells. And in insulin resistant, when a cell is resistant, the insulin receptor site is impaired, and insulin is unable to transmit these signals and initiate the uptake of sugar into the blood. So then what happens is, we eat that banana, the cells are getting the signals, and glucose, the sugar in our blood, is continuing to accumulate. And that's what leads to elevated blood sugars. And so
because they can't get in the cell.
Yeah.
Because they're being clogged, those receptors.
And so people would think to blame the banana, blame the source of the sugar, and say, reduce the sugar and you'll have less sugar in the blood. While that may be true to an extent, there is something that's happening in the cell that's really causing the root of the issue. And so research shows that one of the reasons why cells can become resistant to insulin is due to the accumulation of free fatty acids. And this accumulation can happen from consistently consuming a high-fat diet, meaning greater than 35% of our total caloric intake from fats, and from having excess fat tissue. And so when we have excess fats, our fat cells enlarge and then release fats into our bloodstream. And so from the diet side, if we're over-consuming food, or we're over-consuming dietary fats, we can then have this accumulation of fats in our cells. And so this is really what's interfering with the insulin signaling. And so our cells are getting clogged up by the fats and are not allowing our cells to take in the sugar.
And the excess fatty acids, because you're just eating too much food and you're just getting too fat, or you're eating too many dietary fats. And I know in my practice, that's the big aha moment. And we'll talk about that too when we get down to the nutrition. And all these excess fats, they accumulate in cells they shouldn't be in, like muscle cells, and they clog up the receptor sites. And therefore, you cannot get the sugar into the cell. It's excess fats that are the root cause of type 2 diabetes. They cause excess sugar in the blood. And that's exactly what you found out with your research.
Absolutely. And that brings me to my research questions. When I was starting this project, I really wanted to discover the role that ceramides play in type 2 diabetes. I wanted to look at what studies have been done to implicate ceramides in type 2 diabetes. And I also wanted to look at what are the dietary contributors of these elevated ceramides. What do we eat causes this to happen? And I also wanted to look at some of the nutrition interventions that have been done to lower ceramides for the management of type 2 diabetes.
Ceramides, again, is when these excess fats change to that fat.
Yes. So ceramides are a type of fatty acid. It's a really long fatty acid chain, and these get formed when there's an excess of fats. And normally normally fatty acids get used for storage, or they'll get used for energy. But when we have an overabundance, then they turn into ceramides. And that's when we run into issues. They can start storing into tissues that are not meant to store.
Like muscle and liver, even heart. A lot of organs can have excess fats that differentiate into these ceramides.
Mm-hmm.
And then you're also going to talk about ceramides themselves damaging other tissue, right? The studies show that.
Yeah. So ceramides are implicated in in our peripheral tissues, from our muscle cells, brain, kidney, liver, and cells. And when I was doing my research, I lumped my research into 3 categories. The first category I'm going to go over is the clinical research that shows the link between ceramides and type 2 diabetes. And so these are the studies that have been done to show the association of ceramides in type 2 diabetes. And I'm just going to go over to the findings. And so ceramides have been correlated with a higher prevalence of insulin resistance, insulin sensitivity, which means they're correlated with the development of type 2 diabetes. Before we even progress to diabetes, ceramides are already causing damage to our insulin function. And they're associated with people who have type 2 diabetes and for the risk of type 2 diabetes, as well as incidence of diabetes. And so I was surprised to find that there is a lot of studies that have been done to link ceramides, and the studies are very strong. A lot of them have subjects of, participant groups of over 1,000. And so the data is very strong that shows that ceramides are definitely a biomarker for diabetes.
Yep. Unquestionable. And still a lot of people don't even know it.
Yeah.
Yep.
And the next category of research is all the studies that I could find on the dietary contributions to elevated ceramide levels. And what I found were that saturated fatty acids were consistently associated with elevated ceramides and a high dietary fat intake, so greater than 35%, and sugar sweetened beverages, as well as high intake of calories and overfeeding.
which means it turns into body fat, which then becomes these fats that release into the circulation.
Yes. So even so you can get elevated ceramides from taking in a high amount of dietary sources of fat, or just consuming an excess amount of food. If you're not burning it off, then it's going to be stored as fat. And so they both end up in the same place. And what was interesting was that in the nutrition studies, they use high fat dietary protocols of as low as 36%, 44%, and 45% of total calories.
Which is like pretty typical. Like the typical American diet is going to be about 40% fat. So, right there, even if they're lean, and I'll talk about some of my patient situations, they can be thin, lean, at their ideal body weight, but consuming 40% of their diet from healthy fats, avocados and nuts, and be developing type 2 diabetes.
Yeah, so consuming as low as 36% of our total intake of from fats.
And so let's explain that too in
Yeah.
grams, because people don't typically think of percentage when they eat, but they look at grams on a label. So that's going to be 40 grams to maybe 90. So if I have somebody who's 6'4", a bigger guy, it's going to be 90 grams. Somebody like you, 5 feet, 5'1", it's going to be more like 40 grams. So it's really going from 5'2" to 6'4". And then the peripheral, you're talking people under 5 feet or people over 6'4". It's literally going to be 40 grams to the high end 90.
Yeah.
And in most restaurant meals, people will get 70 to 80 grams in one meal because you don't realize how easily those add up. And are you going to talk about what the range is, the typical range of fat, percentage of fats is anywhere from 20 to 35%?
Yeah, so I'll go over that
Okay.
in my nutrition intervention. So
Also, I don't know if you had this in the research paper because I know you and and you have research on it. Did you include in this paper how the ceramides leave these, they're accumulating because you're just eating too much fats. They get into the blood, the plasma, and they actually go to other healthy tissue like heart tissue, causing problems with valves. They go into the pancreas. They can cause type 1 diabetes, kidney disease. They actually can kill other cells, even muscle cells. Do you have any research in this paper on that?
yeah, I did come across another literature review that looked at all the data linking ceramides to chronic diseases. And there was a lot of studies that were done on how ceramides impacted many cardiovascular conditions, and from heart attacks to just cardiovascular disease and coronary artery disease. And there's just
these little fats get in there and create what's called apoptosis, where they actually kill the cell through the membrane of the cell. And that's what causes the tissue damage and healthy tissue, which is why when you have type 2 diabetes, there's such a high association with kidney disease, dementia, cardiovascular disease. It's almost like they go, okay, you get type 2 diabetes. Oh, by the way, you're going to have all these other diseases as well. And what we're finding and what you found in your paper, it's so associated with these ceramides.
Yeah, and that's what's interesting is I watched Dr. Summers' lecture. Dr. Summers is a professor who's researched ceramides and written a lot of the clinical papers on it. He talks about the scary part about ceramides is that they can induce cell death. So cholesterol doesn't do that, but ceramides can. And so that's what makes this type of fat so dangerous in our in our tissues.
And I want to go back, because I'm going to keep going back to diet, is that this is reversible. If you can understand the macronutrients you eat, protein, fiber, carbs, and fat, all have a certain percentage, a certain amount you should be eating. And the Mediterranean diet, which you're going to talk about, doesn't really tell us much. Let's talk about that one.
Yeah. And so that brings me to the next group of data that I found on the nutrition interventions to lower ceramides. And the studies that I found tested some diets, such as the Mediterranean diets. In some cases, they lowered. In some cases, they elevated ceramides. So it was a bit inconclusive, but in the cases where they elevated ceramides, the ceramide activity was inhibited. So it's
Mediterranean
interesting.
diet. Let's talk about that. That's my
Yeah.
biggest pet peeve. So these are by doctors, not RDs, right? I don't see any RD on that, right? So these doctors are saying Mediterranean diet, well, that's a type of diet that's going to have olive oils and nuts. We don't know how much, but it's a lot of vegetables and good foods. But there's no reference into the amount of fat. It's just the type of fat.
What's really tricky about the Mediterranean diet and in these studies is it was so hard to find out what the Mediterranean diet was, what it was the specific nutrition protocol. It was hard to find any consensus, even among the different studies that claim to use the Mediterranean diet as an intervention.
Because you can be on a Mediterranean diet and be at 40 to 50% fat.
Yeah, it's really just a list.
You can be a Mediterranean diet and be at 20% fat.
It's really just a list of foods. But when people hear Mediterranean diet, they tend to think, oh, it's the diet high in healthy fats. And
which it is.
But
it's about total fats.
Yeah. And so what we're here to talk about is that total fats really matter. And while we do want to be conscious about leaning towards the plant fats, we do want to make sure that we're not over consuming fats.
Right.
And so this is the clinical research on the nutrition interventions, and what I found from those studies is that the diets that consisted of higher plant food consumption, so high fiber diets, were associated with lower ceramide levels and were used as interventions to lower those levels. And also some supplements, so inulin, which is a type of fiber, was used as an intervention to lower ceramides. And these studies showed that not only do high fat intakes cause elevated ceramide levels, but that saturated fats were consistently associated with high levels of ceramides.
And saturated fats, let them know what kind of.
So yeah, saturated fats is mainly going to come from animal foods, but it's also in some plant foods such as coconut oil and palm oil.
Yeah.
And so based on these, on the clinical data and these research findings, I propose the following nutrition intervention for lowering ceramides for the management of type 2 diabetes. So number one is to keep dietary fat intake between 20 and 35%. And from what I learned, from Myrna, in dealing with patients who have diabetes, if you already have insulin resistance and diabetes, it's probably best to lower the fats. You found that
I
do
found
better with around 25%.
What I do with the formula I give everybody is, if I'm dealing with the masses, I'm conservative. And I'm going to put them at 25% because I don't know if they have diabetes. I don't know if they have heart disease. So if I tell the masses 25%, then I feel like I'm at least on a more conservative. That means that you take your ideal body weight and you divide it by 3. Okay, so your ideal body weight, you divide it by 3, that's going to give you 25% grams. So if you weigh 100 and maybe your ideal body weight's 125 pounds, I'm not saying what you weigh now. I'm saying your ideal body weight. So if your ideal body weight's 125 pounds and you weigh 200, you're going to take the 125 pounds, you'll divide it by 3, and you're going to get, let's say, 40 grams or 45 grams. That's 25%. Then you can easily add 20 grams to that to get to 35. So that's the range to just give people a ballpark of where they need to be.
Yeah. And I also found that high fiber, high plant food diets were associated with better diabetes outcomes and lower ceramides. And so in a lot of the interventions, they used the vegetable protocol of as much as 3 cups of vegetables. And
that's minimum. In my world.
Minimum.
Right.
Yeah.
I'm telling patients 35 grams, which I notice you have there, of fiber, a lot of soluble fibers, some of the inulin she just talked about, different types of fibers. But 35 grams to me is minimum.
Yeah.
Right. Now, if you're not used to high fiber diet, you can't just jump up to that amount. Like if you're eating 8 grams now, it could take a couple months to get the body used to that because it's a lot of digestion and fermentation. But ideally, it's going to be keeping your fats where they need to be and upping your fiber.
Yeah, absolutely. And then also I'll show you kind of what that can look like visually on your plate. And so by adhering to the Diabetes My Plate, we can see how we can portion our macronutrients on our plate. And so diving a little bit more into the dietary fat recommendations, I found that the American Heart Association and the American College of Cardiology recommended a saturated fat intake of no more than 5 to 6%. So that's where I recommend less than 6% of total intake to come from saturated fat. So
and that turns out to be 15 grams.
Yeah.
Which is like 1 tablespoon of butter. Just to give you an idea.
Yeah.
15 grams out of your 45 grams total for animal fat.
Yeah, so we do want to lean more on the mono and the plant sources of fats and limit the animal sources. And so again, the high fiber diet, at least 35 grams of fiber, 3 cups of vegetables.
Minimum.
Yeah. And this was like a plate that I put together for my community rotation where I was helping to put this into perspective of how to portion your plate. And so we want at least half our plate to consist of non-starchy vegetables, and then a quarter of lean protein, and then a quarter of high fiber carbohydrates. So following this kind of guide helps us keep our plate very balanced, and it's good for blood sugar control because
I want to say one thing.
Yeah.
I love that plate. That's beautiful. And I know the next slide you're going to show this, but you throw olive oil over that and you're screwed.
Yeah.
Okay. So all those vegetables look great, but if you have 2 or 3 tablespoons of olive oil, you just screwed up the whole plate.
Yeah. And so that's where being conscious about how much fat is going into the meals. If we're trying to stay within 40 to 60 grams in a day, then that can look like 10 to 15 grams per meal. And so we just want to know your numbers, know what's going into your food. So we're avoiding consistent excess intake.
A lot of people say, oh, Myrna advocates a low-fat diet. I'm like, no, I don't.
It's not about a low-fat diet.
30% is not, it's just that you're used to eating a ton of calories.
Yeah. It's about the right amount of fat diet. And so this is just a visual to show you how you can, how there's a difference between eating healthy food and eating in a healthy dietary balance.
Yeah, because they look the same.
Yeah. They look the
But she's
same.
going to show you they're very
And
different.
then, so this just shows that without knowing the, how it's easy to over add the fats.
Like
So,
those look like the same, but obviously,
so here we took out some of the avocado.
right?
We also cut down some of the meat.
Right?
We're still able to have an adequate amount of protein.
Mhm.
And then the same thing here. We cut down some of the cheese and we cut down some of the meat.
Right.
And so just from cutting down on the sources that are higher in fat, we're going to.
And that right there, I can just tell you as a dietitian, from the 400 calories to the 770, you're probably taking out about 20 grams of fat. Just right there in the two differences of that meal.
Yeah.
Okay? People don't realize like one avocado is 25 grams of fat.
Yeah.
I'm not saying it's a good kind of fat. I mean, it's better to have the avocado than to have the butter as far as the ceramide's concerned. But bottom line, if you're doing 2 or 3 avocados a day and nuts, your fats are going to be up over 100.
Yeah.
And that can be a problem. That's all we're saying. That can be a problem.
Yeah.
Even though they're healthy fats.
It's really easy to over add it without even realizing and without knowing the macronutrient breakdown of your regular meals. We can unknowingly overconsume dietary fat on a daily basis.
Chips. You go to a restaurant and they're putting oil on everything.
Yeah.
So one meal at a restaurant, if you actually look at the nutrition information, you'd be surprised that one meal can be literally 50 grams of fat.
Yeah.
And it's all healthy. That's the ticket. It's all healthy food, but they're putting way too much fat in it. And this is a root cause of type 2 diabetes, is all this excess fat.
Yeah. And that's, it can also be an issue in the way we cook and prepare foods. And that's why it's hard to control that at restaurants when they're often cooking.
I tell all my patients,
yeah.
steam your vegetables, cook your vegetables in liquid. It's just a habit. People are in a habit of throwing in the oil and cooking in the oil, which adds another 2 to 3 tablespoons.
Yeah.
So cooking it in the liquid to me is fine. You can thicken it up with a little cornstarch and all those flavors stick to those vegetables. You've taken out the fat and you've cooked it in liquid and you've literally helped reduce your risk for metabolic diseases just by doing that.
Yeah, absolutely. And so, and in conclusion, evidence shows that plasma ceramides, so ceramides in our blood, are a significant biomarker indicator for type 2 diabetes. And by keeping overall dietary fat intake between 20 and 35%, limiting saturated fat sources, and eating a high fiber, high plant food diet, we can manage ceramide levels and reduce the risk of developing diabetes and decrease the progression of diabetes.
And cardiovascular disease, also the dementia is related to it. A lot of these diseases, ceramides are implicated in progression, okay? So, and there's plenty of studies on that. You can type in ceramides and dementia, you'll get a whole slew of stuff. Ceramides and heart disease, again. So ceramides, I want to make a special note because ceramides are actually healthy fats found in certain, like in the skin. We have ceramides in the skin, and I know a lot of people will use ceramides on their skin for treatment. So this is, it is a type of fat, but in relationship to how it develops within the body in this respect. So I want to just make that note in case some dermatologists are watching or people are putting ceramides on their skin and they're worried that maybe that's implicated with type 2 diabetes, and it is not. We're referring to it when it gets into the cell because of the food you're consuming. Or maybe you're on a low-fat diet, you're really watching the fats, but you're just eating too much, right? And then you're getting fatter. So there you go. It's all coming down to the fat.
Yeah, absolutely. Yeah, and it was this big aha moment after speaking with Myrna about my research, that type 2 diabetes really is a lipid disease. It's a disease of excess fats. And so, um, you know, even if you're consuming a lot of sugar, that can turn into fat. And so,
And you can be lean. So this was a lot, this was like the big quandary, because it's like, okay, why am I getting type 2 diabetes and I'm at my ideal body weight, right? I mean, I look good, I'm exercising. Why am I getting type 2 diabetes? And it comes down to their diet choice. They're just not getting those macros right. They're getting way too many dietary fats in their diet, even though they're lean, because we already know that excess fat doesn't necessarily make you fat, okay? But it can cause type 2 diabetes.
absolutely. Yeah, and these are my references.
A lot of references, by the way. It's a lot of work.
Yeah, there's over 40 studies that I looked at. And so there's just so much research that's been done on ceramides. The evidence is abundant. And what this means in clinical practice, I mean, hopefully someday the ceramide test will be added to our regular lipid panels.
And what worries me, and I know I know Dr. Summers, he's amazing, the amount of work he's done. And I think he got like a $10 million grant to really further the research on diabetes and fats. But it was to help get a drug, okay? And just like with statins and all these drugs, you've got the GLPs people are taking out. It's so pharmaceutical related. And what I think is really crazy is it's all induced by your diet. So if you fix your diet, then a lot of times you're not going to even need the drugs.
Yeah.
Now, granted, if you've had a lot of, I'm not going to lay that blanket statement, but I can tell you that I just had a patient this week. It's 70 years old. His lipid panel was terrible. His cholesterols were really high. He had 5.9. He was considered really a diabetic. He's on his way. It's 70 years old. This is what was going on. And he was maybe only 25 pounds overweight, still overweight, but not like he's massive overweight. And at 75, we just got his lipid panel. He is 123 for his cholesterol, no statins. His LDL, and his A1C is 5.5. And he isn't eating more. Now he's like 5'10", but he isn't even eating more than 40 grams of fat.
Oh, wow.
Because he had some issues before, and he's like, I'm just going to be conservative. I don't want to get diabetes. So increasing his plants, eating a lot. I'm not going to say it was 100% plant-based, because we're making, he does do some shrimp, some fish. But we really, really watched those fats. And we brought in the carbs, people, especially the high fiber carbs, a lot of plants, and this guy at age 75 has reversed cardiovascular disease, has reversed diabetes. So with age, he's getting better. Wow. No statins, off statins. Wow, so I just thought I'd throw, yeah.
It just goes to show the power that changing your diet can really have in changing the course of your disease outcomes.
Yeah. And when you eat right, you have all this energy. So you can be on these drugs and it's really not going to be a slam dunk, because these ceramides, and you didn't talk about this, but I'm going to bring it to the table. They are an arthrogenic fat. What that means is these ceramides, they're not measuring them. They actually go into the artery wall and cause plaque. Now, we already know that the LDLs do this, so we get tested from our doctor and they look at these bad fats, but they're not looking at the ceramides. And they are doing just as much damage in creating plaque as the LDL. So in other words, you could be on a statin, your lipid panel looks fine because the statin's controlling that, but you could be in higher risk because there's other fats they're not measuring that are causing the plaque, which, by the way, a lot of people on statins get heart attacks. We already know that, right? So it just brings home the whole idea, why not learn how to eat right? Can I do a plug for my book?
Yeah.
Here we go. Why your diets fail and the science that really works, right? Because in here, I talk about a lot of what you've said and the importance of balancing those macronutrients, protein, fiber, carbs, and fat. Get those right, and everything else defaults.
Everything else
Goes
falls
back
into
to
place.
falls into place.
Yeah.
Anyways, awesome. I can't wait till she becomes an RD because she's going to work with me. We're going to have so much fun treating all these patients. And hopefully you guys learned a lot. I always learn more and more every time I go over this. And I'm going to look through some of those references too. Some of them looked really good. I want to just kind of pick your brain on some of those. So until next week, if anybody has any questions on the chat.
You got one. Just read it off.
Oh, okay.
Does the presence or do their presence or level go down once you start doing the Myrna method, limiting fat intake? Well, we can't say for sure because we don't yet have a test to measure ceramides. But if you're asking me in my practice, when I do reduce the fats, do I reverse type 2 diabetes? And the answer to that question is yes. So until we can get a test, an actual blood test to measure these and make it standard, I'm going to say if I'm lowering the diabetes, taking a patient that was a 5.9 down to a 5.5 or lower, then we're going to assume those ceramides are also lower because they're associated with it.
Yeah, and since ceramides are associated with LDLs, then the lipid panel can be a good indication to
Not always. I really want to make that point. I have patients come to me, they're on statins, their LDLs look great, but they have type 2 diabetes.
They still have insulin resistance.
And statins can actually increase your risk for type 2 diabetes, by the way. Just want to throw that out there. So, yes, answer this question. I'm going to say that I know that as soon as I start people on the right diet, I get lab values that improve within 4 weeks.
Yeah, and since the Myrna method is about having a high fiber diet and keeping those fats in the ranges that we discuss, those fall in line with the clinical evidence that shows those nutritional interventions do lower ceramides. So in the interventions where ceramides were measured, high fiber and lowering the fats to 20 to 35% is what lowers ceramides.
Right.
So yeah, we just don't have a way in clinical practice right now to measure, but in these clinical trials they have measured ceramides and associated them with those nutritional interventions.
And by the way, a couple of the doctors I work with, one particular, Dr. Matthijs in Vero Beach, works with cardiology mostly. He said they're 25 years behind the research, which I'm like, what? He goes, yeah, which would make sense because we've had this information for the last 20 years because I've seen the papers.
As early as 2002 is what I found.
And now we're 2025. So I guess there's some truth to that. It's now finally catching up to where, oh, this is something that could be serious. So to me, it's all about getting the diet right. In fact, the Mayo Clinic, the Cleveland Clinic, they will all tell you nothing beats the diet. That means drugs. Nothing beats the diet. They can't. And by the way, you can exercise, and it does not mean, exercise is great, but it's only about 10 to 15% of this. I have a lot of athletes, great, exercisers. They look great. They're lean. They look gorgeous. What beautiful muscle. And their A1C is diabetic level. Okay. Because they're doing all these healthy fats, thinking they're following this, protocol, Mediterranean diet, but their fats are like 40%. And they're over the age of 60. That's usually where I kind of chime in. As you're over 60, your margins change and you don't really get to have as much liberal food margin. You know, it's really longevity. Longevity is really about not getting metabolic disease. That's what longevity is. Don't get heart disease, dementia, or diabetes, and get that weight down to your ideal level.
Absolutely.
Simple. Think simple. Anyways, so any other questions?
No, I think we're good.
Awesome.
All right.
Okay.
So
Thank
have
you
a great,
so
and you know what? I don't know, maybe this isn't a good one to do around the holidays. I'm just thinking, right? Or maybe it is. Maybe it is.
It's interesting.
It's interesting.
Yeah.
Okay. All right.
Till
Till next week.
next week.
Don't forget to like and
Oh, don't forget to like and subscribe. Always want to remember to say that.